If you're postpartum and you've been told you have a diastasis recti or you're worried you might have it, this video is for you. I'm Alyssa, a pelvic floor physical therapist who specializes in postpartum recovery. I need to tell you something that might surprise you. 100% of women have diastasis recti by the end of their pregnancy. Every pregnant person develops some degree of abdominal wall separation by the third trimester. It's not a pathology, it's not an injury, it's normal adaptation to pregnancy. So if diastasis recti is universal, why are we treating it like it's some catastrophic problem? More importantly, what actually matters when it comes to your core function postpartum? That's what we're covering today. Let's dive in. Diastasis recti is the widening of the linea alba, or the connective tissue that runs down the middle of your abdomen, connecting your right and left rectus abdominis muscles, or your six-pack muscles. During pregnancy, as your uterus grows, that connective tissue stretches to make room for your baby. The tissue between the abdominals stretches and thins. By the end of pregnancy, almost every woman has at least a 2 or 3 finger width gap or separation at the belly button. This is completely normal and necessary. After delivery, that tissue starts to come back together. For most folks, it narrows significantly in the first 8 to 12 weeks postpartum. Here's the key. It doesn't always go back to pre-pregnancy width. Research shows that about 60% of women will still have some measurable diastasis recti at 6 months postpartum. About 30 to 40% will still have it at a year. The presence of a gap doesn't always predict symptoms or dysfunction. Having a gap does not mean you have a problem. Here's what the internet gets wrong. Everyone focuses obsessively on closing the gap. Do these exercises to close your diastasis, or avoid crunches or you'll make it worse. Truly, the research does not support this approach. What actually matters is not the width of the gap, it's the function of the tissue. Think of it like this. Would you rather have a 2 finger width gap with good tension and good coordinated muscle function, or a 1 finger gap with really poor tension and a belly that domes with every movement? The second scenario is way more problematic, even if the gap is narrower. Here's what research actually shows. Width alone doesn't correlate with symptoms. You can have a 3 finger gap and be completely asymptomatic. No back pain, no pelvic floor dysfunction, no functional limitations. What we find in research and clinically in our practice is that the depth of the diastasis recti actually matters more. When you assess for this, you're looking at the depth of the separation, not just the width. This is where assessing depth and the ability to put tension through the system matters way more than the width of the gap alone. Functional capacity is really the goal. Can you lift your kid without back pain? Can you run without leaking? That's what actually matters. If the gap itself isn't really the problem, then what is? The loss of tension and tissue integrity. If the linea alba doesn't have good tension, it can't transfer force between the sides of your core. This creates compensatory problems and contributes to back pain, pelvic floor dysfunction, postural compensations, rib flaring, anterior pelvic tilt, overuse of your hip flexors. It can really perpetuate an overall core dysfunction, which again is more important to address than just the gap itself. Now, the goal really isn't to close your diastasis. The goal is to restore tension and integrity to the linea alba, retrain coordination between your core muscles, eliminate any sort of pathological doming or bulging with movement if it's creating symptoms, and then build strength and capacity for your life. When you focus on those things, the gap often narrows as a side effect. Even if it doesn't fully close, you can be completely functional and symptom-free. What should you actually be doing postpartum? The first thing is start with breathing and coordination. Before you do a single crunch or even a plank exercise, reestablish coordination between your diaphragm, your pelvic floor, and your deep core. So you can practice diaphragmatic breathing, 360-degree rib cage expansion, pelvic floor relaxation with inhalation, gentle engagement with an exhalation, really making sure that you're able to do this without bearing down or without symptoms. This truly is foundational. Don't skip it. Then we want to progress to more functional movement patterns. We can integrate core work. So it could be more functional patterns like rolling, getting up and down from the floor, squatting, lifting with proper technique and breath coordination. These really teach your core to work more as a system and not just in isolation. We can add in other anti-rotation exercises and exercises that are just really effective, even more so than crunches. It could be dead bugs, bird dogs, Pallof presses, planks when you're ready, side planks, farmer's carries. You can eventually do crunches. Poorly executed crunches where you're doming and symptomatic, sure, that might be problematic in the moment. Once you have good tension control and you can do a crunch without having any sort of symptoms or again, more pathological doming, then they're fine. They're helpful for actually building strength. The key to this is progression. You don't start doing crunches at 2 weeks postpartum. You don't have to avoid them forever either. Also, working with a pelvic floor PT. Get assessed by someone who can evaluate your DR for width, depth, tension, who can assess your core and pelvic floor coordination, as someone who can identify compensatory patterns, and then ultimately give you a personalized plan. Because not all postpartum bodies are the same. Surgery should really not be the first line. Diastasis recti is a normal postpartum adaptation that sometimes needs rehab. Your body did something incredible. Now it's time to rebuild it in a way that's smart, functional, and sustainable. If you're looking for a pelvic floor therapist who specializes in DR rehab, especially if you're trying to avoid surgery and potential implications post-surgery from a pelvic floor perspective, let's chat. You can text us, give us a call at 413-224-6657 if you are local to the East Longmeadow, Massachusetts area for help.